Hello friends, 57-year-old man with a 4-hour history of chest pain radiating to his neck with an associated diaphoresis and dyspnea. His creatinine kinase and MB type and troponin levels are elevated. Okay, that means there is some type of SMI. And his electrocardiogram shows anterior wall ST segment elevation. Definitely there is some MI. He dies suddenly after ventricular tachycardia and ventricular fibrillation arrest. The gross appearance of his heart is shown. What is your diagnosis? So here in this you can see that here there is some thrombus. Okay, this is the left anterior descending artery. So in the left anterior descending artery there is an acute occlusive thrombus which is seen. What endothelial mechanisms modulate the vascular event that precipitated? So the endothelial anticoagulants like thrombomodulin, prostacyclin, adenosine diphosphate, activated protein C and protein S, all these will inhibit the various aspects of platelet aggregation. Thank you for watching.